So, hi everyone, I'm Dr. Abhin Miglani. We will be discussing external carotid artery today. So, it is the principal artery supplying the structures in front of the neck and face. Any catastrophic hemorrhage to the artery or its branches requires its ligation. So, the ligation points will be discussed in the next part of the PPT. So it lies anterior to the internal carotid artery. So in relation to the internal carotid artery, it can be in two aspects we can see it from. So in the superior part of external carotid artery, it lies anterolateral to the internal carotid artery, and in the inferior part of the external carotid artery, it lies anteromedial to the internal carotid artery. So in this diagram, you can easily see that in the superior part, it lies anterolateral to the internal carotid artery, and in the inferior part, it lies anteromedial to the to the internal carotid artery. Okay, so then coming to the surface anatomy of the external carotid artery, it can be marked by joining 2 points. So the 2 points are the point A and point B. A point refers to the anterior border of the sternocleidomastoid at the level of upper border of thyroid cartilage, while the point B is the posterior part of the neck of mandible. So the this point of intersection of both at the anterior border of sternocleidomastoid marks the external carotid artery. So it is a branch of common carotid artery and develops from the third bronchial arch, which is also known as the aortic arch. It develops in fourth to fifth week of intrauterine life. The course is in two parts, in carotid triangle and above the carotid triangle. So in the carotid triangle, it lies beneath the anterior border of the sternocleidomastoid, and above the carotid triangle, it lies uh, deep to the parotid gland. Okay, so let me mark. Here we can see the anterior part of the anterior border of the sternocleidomastoid. Okay, so now coming to the branches of the external carotid artery. So in this diagram, we will be referring to the branches. Let me take you to the written part first. So the branches can be divided into four parts: anterior, middle, posterior and terminal. So anterior मतलब आगे की तरफ कौन सी ब्रांचेस जा रही हैं, सो हम इसके अंदर देखेंगे। सबसे पहले कौन सा है, सुपीरियर थायराइड आर्टरी जो कि एंटीरियर ब्रांच है, फिर लिंगुअल आर्टरी, देन फेशियल आर्टरी। ये तीनों ब्रांचेस देखिए आप आगे की तरफ जा रही हैं, तो ये सारी एंटीरियर ब्रांचेस हैं। उसके ऊपर आएंगी हमारी असेंडिंग फेरेंजियल आर्टरी, विच इज़ अ मीडियल ब्रांच बिकॉज इट्स टर्निंग मीडियली. So here we can see the ascending pharyngeal artery. This one. You can see. Okay. So then coming to the posterior branches, which are the occipital and posterior auricular artery. Then coming to the terminal branches, which are the superficial temporal artery and the maxillary artery. Okay. So now coming to the directions of its course. So let me erase this thing first. Wait. Hmm. Then coming to the direction of its course, that the external carotid artery runs upwards, backwards, and laterally. Okay, so here in this diagram we can see that this external carotid artery we are seeing here, it runs upwards, backwards, and laterally. Okay, so now coming to the superior thyroid artery. So first of all, we will understand what are the parts of the hyoid bone, because in relation to its cornua and or horns, we are referring to the emergence points of some of the arteries in the which are the branches of external carotid artery. So this is a hyoid bone, and it contains two horns which are greater, two greater horns and two lesser horns. Okay, so these horns are also known as the cornua. So we will be seeing the first of all superior thyroid artery. So this diagram I have made for the hyoid bone. So it origins below the greater corner of hyoid bone, and it runs downwards and forwards to supply the upper pole of thyroid. And the superior thyroid artery is parallel to the laryngeal nerve and also superficial to it. Okay, so the ligation is done near the gland to prevent the damage to the external laryngeal nerve. So the ligation parts near or far away from the gland, and the prevention of damage to external laryngeal nerve and recurrent laryngeal nerve will be covered in the next slide, in the next seminar. So this is a diagram you can also copy for your exam point of view. So this common carotid artery is bifurcating into an internal carotid artery and an external carotid artery, which moves upwards to provide superficial temporal artery and maxillary artery, which are the terminal branches. Then coming to the medial branch, that is the ascending pharyngeal artery. Then coming to the anterior branches, that is the lingual artery, facial artery, and superior thyroid artery. And then coming to the posterior parts, the occipital artery and the posterior auricular artery. So bronchial fistula or sinus passes between the two carotids. So the what is a bronchial fistula? It is a rare congenital neck abnormality, essentially a small tunnel or tract connecting the throat to a tiny opening on the skin, usually on the side of the neck, that drains mucus or fluid due to complete closure of embryonic bronchial arches during development. Okay. So coming to the level at which the common carotid artery bifurcation is seen. So it is seen at the level of thyroid cartilage. Now coming to the lingual artery, so its origin is from the level of the greater corner of hyoid bone, unlike the superior thyroid artery, which had the origin below the level of the greater corner of hyoid bone. Okay. Then coming to the next part of the lingual artery, that is the we will be studying how is the course of the artery, lingual artery, in relation to the hyoglossus muscle, because hyoglossus muscle is one of the major muscles present there in relation to the lingual artery. So this diagram you can use in your exams to make it more elaborative. So we will be dividing the lingual artery into three parts. The first part is the one which forms a loop around the hypoglossal nerve, and it lies in the carotid triangle. Then the second part, deep to the hyoglossus, and the third part, it runs upwards where it is known as the deep lingual artery or the renine artery. Then the loop formed by the first part helps in easy movement of the hyoid bone during deglutition. So this loop has an enough space to provide the hyoid bone during the deglutition, and during glossectomy, it is ligated at the first part before it gives branches to the tonsils and tongue. So here at the first part, it will be ligated. I hope I'm clear till this point. Then coming to the facial artery. So it is one of the most important branches of the external carotid artery. It has a tortuous course for giving muscles free movements. It origins above the level of the hyoid bone, unlike the lingual artery and the superficial thyroid artery. Sorry, superior thyroid artery. So, facial artery has two parts, the cervical and facial. So, the mnemonics we can be using for both the cervical and facial parts is that, see, the cervical part starts from the sound s. So, it will be attracting a lot of stags. Okay. So, getting elaborating the stag, we will be getting submental, tonsillar, ascending palatine, and glandular branch of the submandibular gland. Okay, and then coming to the facial part. So I had a friend known as her name was Lisa. Okay, so she was very much interested in doing facials and all, and very much interested in going to beauty parlors. So from her, I got to be name this facial part of the facial artery as Lisa. Okay, so the lateral nasal, inferior labial, superior labial, and angular. Okay, so let's make it again. The cervical part will be having four branches: the stag, submental, tonsillar, ascending palatine, glandular branch of the submandibular gland. Okay, then coming to the facial part, the which has branches: lateral nasal, inferior labial, superior labial, and angular. Okay, so the cervical part has the course as follows: the greater corner of hyoid bone, then superior constrictor of pharynx, to be very precise, above the greater corner of hyoid bone. Okay, superior constrictor of pharynx, stylohyoid, posterior belly of digastric, grooving into the posterior border of submandibular gland, reaching the base of the mandible. Okay, so let me take you to the diagram again. Yes, yes, yes. So Here we will be seeing that there are two parts. The one is the facial part and one is the cervical part. Okay. So the cervical part, it will be in close relation to the greater corner of hyoid bone, posterior belly of digastric, submandibular gland, and it will be having the branches. What will be the branches? Tell. Yes. Well, the branches will be submental, tonsillar, ascending palatine, glandular branch of submandibular gland. Okay. Then coming to the facial part. So facial part is starts from the anterior inferior part of the masseter muscle, goes to the corner of lips, then lateral nasal, and terminates in the medial canthus of the eye. Okay. So what is the other name of the facial artery? It is also known as the anesthesis artery because the pulsation can be felt at the angle of mandible at anterior inferior part of the masseter. Then coming during to many reconstructive procedures, it acts as an anastomosis point. For example, submental fibula, so not in submental, but in fibula, radial forearm, platysmal flap, we will be using facial artery as an anastomosis point. Then coming to the reduction of during the highest during the reduction of mandibular fractures, there are chances of injury to the facial artery, so the pressure pack can work, but if not, it needs to be ligated. And there is one maneuver known as the Hayes-Martin maneuver, which can be used while retraction of the perimandibular envelope to prevent any injury to the marginal mandibular nerve. So here lies the facial vein, facial artery all together along with the so here it lies the facial vein, facial artery, along with the marginal mandibular nerve, along the anterior aspect of the masseter muscle, which needs to be retracted upwards to prevent easy retraction of the perimandibular envelope and prevent any damage to the marginal mandibular nerve. Okay. Now coming to coming to the lingual artery. Okay. So wait. So we will be studying occipital artery now. So occipital artery arises just opposite to the facial artery from external carotid artery. It lies below the posterior belly of digastric, and hypoglossal nerve crosses the artery at its origin. Okay. So sorry. Mm, I will show you the diagram later. So it from the part from which the facial artery arises. So we studied earlier that the facial artery is an anterior branch of the external carotid artery. So just opposite to it from the main trunk, there is a release of an occipital artery. So if this part releases the facial artery from just opposite to it will be occipital artery, the posterior branch. Okay. So the hypoglossal nerve crosses the artery at its origin. Then coming to the posterior auricular artery. So posterior auricular artery arises just superficial to the stellate process, deep to the parotid gland, and grooves the base of mastoid to reach the auricle. Supplies auricle, skin over mastoid, and posterior aspect of the scalp. Then coming to the superficial temporal artery. Okay, so the superficial temporal artery is a small branch of the external carotid artery. From S starts the superficial temporal artery. From S starts the small terminal branch of the external carotid artery. Then it originates behind the neck of the condyle. So its course is as follows that it runs vertically upwards, crossing the root of the zygoma into the anterior and posterior branches, which supply the temple and the scalp. So the anterior branch anastomosis the supratrochlear and the supraorbital artery of the ophthalmic artery. It gives transverse facial artery and middle temporal artery on which runs on the temporal fossa deep to the temporal muscle. Okay. Then coming to the maxillary artery. So the maxillary artery is the largest terminal branch of the external carotid artery. It originates behind the neck of the condyle and runs deep to the condyle in respect to the auriculotemporal nerve in infratemporal fossa. Okay, so these are the branches of the of the maxillary artery. So its mnemonic can be as seen that there are three parts. The first is the mandibular part, pterygoid part, and the pterygopalatine part. Okay, so when I was a small kid, na, so in the maid who worked at my house, I used to call her the maida. Okay, so I was small. I didn't know that what needs to be told to her and what needs to be not needs to be told to her. So I used to tell her, "Mums, Papa, do boxing." I'm. It's all a satire version. This is not real. Okay, so just for mnemonic part, I have made that "Mums, Papa, do boxing." Okay, then so my mother's father was a boxer, so mom's papa do boxing. Okay. Then after he has done the boxing, he sends the pigs in the farm for spa. Okay. So the third pterygopalatine will be having the mnemonic of pig spa. Okay. First, I will call Meda and tell that my mom's papa do boxing. Then at the last part, the after boxing, my Nanaji sends the pig to for spa. Okay. So these are the branches of the maxillary artery: the deep auricular artery, anterior tympanic artery, middle meningeal artery, accessory meningeal artery, inferior alveolar artery, and mylohyoid artery. In the second part, we have posterior deep temporal artery, pterygoid artery, mesenteric artery, pterygoid artery, buccinator artery, anterior deep temporal artery. Then coming to the third part, posterior superior alveolar artery, inferior infraorbital sphenopalatine, descending palatine, pharyngeal, and artery of pterygoid canal. Okay. Then coming to the ascending pharyngeal artery. So the small branch of the external carotid artery that arises medially from the external carotid artery runs vertically upwards between the side wall of pharynx, tonsils, middle wall of middle ear, and auditory tube. So I'm sorry. So ascending pharyngeal artery, the medial branch. So eh, we can be discussing it as a which is a very small branch of the external carotid artery that arises medially from the external carotid artery and runs vertically upwards between the side walls of pharynx, tonsils, middle wall of middle ear, and auditory tube. Okay, so ligations. Coming to ligations of external carotid artery, I have written it in very short here, but it will be requiring a different presentation for its ligations part, so which I will be uploading very soon. So only three parts I have made for ligations here. So the lingual artery in is ligated in the submandibular triangle. The facial artery is ligated at the angle of mandible at antero-inferior portion of masseter, and then coming to the complete BCAL. So complete bilateral external carotid artery ligation done in oncosurgeries, next zone 3. Then coming to the maxillary artery. So the maxillary artery, it can be ligated by two approaches, the transantral approach and intraoral approach. So the transantral approach, we will be seeing that anterior wall of maxillary sinus is exposed by gingival incision, and posterior wall of maxillary sinus is removed, and the exposure of pterygopalatine fossa. So we will be reaching to the branches of facial artery. Then coming to the intraoral approach, the incisions of the GBS, incision at the gingivobuccal sulcus at the second and third molar continue inferiorly along the ramus of mandible. Buccal fat pad is retracted medially, and temporalis muscle is attachment is removed, and coronal process is exposed using using direct exposed using blunt dissection. Okay, so thank you so much for listening.